Over 70% of families struggle with paying for dependent care. And even though that's the case, and I believe it to be true, it says that utilization of these dependent care accounts, those old traditional dependent care accounts, was somewhere around 3%. Can you imagine, right? So 70% of people are struggling with this problem, but only 3% of people are taking advantage of this, this system that might help them save money. And the reason why is the system was old, it was outdated, it wasn't working for people. So I just looked at it from a savings group standpoint, and I said, what can we do to help? And so I was able to eliminate, I think, most of the problems with these old accounts. Dependent care accounts were actually created in 1981, and they have not been updated since. So the product is way over 30 years old, and it hasn't changed one bit since the date it was created. And my wife had the opportunity to enroll in hers through work, and we decided not to because of the restrictions and the rules that the TPA company was putting on her. With the old accounts, you had to pay twice. The money was taken from your paycheck, and it's held, let's say, in a trust account or by the third-party administrator. And then you have to pay the provider. So now you've paid twice. It's coming out of your paycheck, and it's coming out of your bank account. You've paid the provider. And then you submit the receipt to get reimbursed with your own money. That doesn't even make sense hardly, right? I know. So it's different with the savings group. With the savings group, the money's taken from your paycheck, and that money's used to pay the provider directly. It's just one payment. We can even put it on a debit card. And then, like I said, we'll allow you to pay annually up front. So you literally will just make one payment for the entire year, and you pay back the savings group over 12 months. And the advantage that I really have is that I run a savings group, not a third-party administration company. So I'm able to eliminate what I feel were the two big hurdles for dependent care accounts. And that is that contributions were capped at $5,000. You can actually, with the savings group, you can contribute more than $5,000. Number two, will allow you to pay the annual balance to your child care or preschool provider upfront, day one. And then you're gonna pay the savings group back over 12 months. So you're gonna take advantage of any additional savings that your preschool provider is offering when you're able to pay the annual tuition right up front. So I'm excited. I think it's gonna help a lot of people. It's gonna help a lot of families pay for really good care for their children. Dependent care accounts are specifically just for dependent care situations. But I was able to take what I do, which is I operate a savings group, and I was able to upgrade an old, outdated system. And I've been able to do that with a lot of things. So I've been able to do that with like flexible spending accounts and health reimbursements, where claims payments might be variable and make them fixed, make them even or predictable for employers. I've been able to do that just for individuals and self-employed people and employees, where if they have high out-of-pocket medical, dental, or vision expenses because their insurance has gaps in the coverage, instead of having unknown claims expenses, whenever they get sick, which they can't predict, we turn that into just a predictable monthly even payment, right? And if they're healthy and they never use it, they get that money back. It's a savings account. So I've been able to use the savings group to help people in lots of different areas.